Good evening, everyone, and thank you so much for joining in our webinar this afternoon. I apologize about that amazing audience, the challenges of working from home and having young children. Thank you so much for joining us this evening. We are here representing Texas Southern University from the Center for Biomedical and Minority Health Research. We have the Community Engagement Core, and over the next hour, we will be discussing managing my hypertension in the era of COVID-19. So Community Engagement Core of Texas Southern University's Center for Biomedical and Minority Health Research. We work directly with the Greater Houston community individuals to identify and address health-related concerns. We provide health-related resources to community members through partnership with healthcare systems, federally qualified health centers, as well as community and faith-based organizations. We host diverse health education events across the Greater Houston community in order to raise awareness in clinical trials and reduce health disparities related to ethnic minority community. For more information about our program, please feel free to follow us, like us on all our Facebook or social media handles at CEC Texas Southern U, or please give us a call, 713-313-1986. Okay, disclosure here, we are privileged to have received funding from the NIH to be able to establish our center, and this funding is from RCMI, the Research Center for Minority Institution Programs, and this is where we have the funding to be able to run the program. So we are grateful to the NIH and the leadership of our center for this opportunity to have this program today. Additionally, for today's program, we are partnering with one of our community-based organizations called the Third World Community Clothes Cooperative. So many thanks to the Third World Community Clothes Cooperative, and thank you for partnering with us. This organization started with about 16 different organizations in 1992, and it has grown to over 325 community-based organizations, churches, schools, and businesses, serving one of the Houston's oldest inner city neighborhoods. Their contact information is listed, so please feel free to reach out to the Third World Community Clothes Cooperative for more information on their diverse programs. Once again, I want to say a big welcome to everybody. Thank you all for joining us. Please remain on mute throughout the course of today's presentation. There will be question and answer session at the end, but feel free to drop in any questions, any thoughts, any comments in the chat box, and we will be answering those questions as we go. And there would also be an opportunity for you to unmute yourself and be able to ask questions at the very end of today's event. We would also like to hear directly from every one of our wonderful attendees this afternoon or this evening. So please feel free to complete a survey, which will be posting the link to the survey. Is going to be posted in the chat box. So we want to hear from you about your perception of today's seminar, and also if there are any topics that you'd like us to focus on in the upcoming events. We do have a giveaway of $10 gift card to the first 10 people that complete the seminar. So please, we have the seminar in both English and Spanish version. Please, we do request that you take a few minutes of your time to complete this survey, and we appreciate that greatly. Couple of upcoming events that we have. We are very excited to announce that we would have our next month's virtual health seminar. It's going to be on April 14th from 1 to 2 p.m. And the title for that is Self-Care and Resources for People Living with Hypertension and Their Caregivers. This is going to be a great session where we'll have a social worker talk about diverse resources available to people regarding hypertension. In the same manner, we are also very excited to announce a big conference on clinical research and engagement. This is going to be on Saturday, April 24th from 10 a.m. to 1 p.m. So please save the dates, save it on your calendar, and most importantly, follow us on all our social media and do so you can stay up to date regarding our upcoming events. Without further ado, it is with great pleasure that I would like to introduce the two speakers that we have for this evening session. Our first speaker is the person of Dean Rashid Musavin. Dr. Musavin holds a Bachelor's of Science of Pharmacy from University of Kansas, and he also has his PhD in molecular pharmacology from the University of Wisconsin-Madison and an MBA from the University of Chicago. Dr. Musavin began his pharmacy career at the University of Illinois, Chicago, and he joined the faculty of Loma Linda University of Pharmacy in 2004. He has held a number of academic administrative positions, including being the Executive Associate Dean in Loma Linda University. Dr. Musavin was awarded the Teacher of the Year and the Spiritual Life Service Award, as well as the Distinguished Service Award in his previous institutions. Dr. Musavin relocated to Houston, Texas in 2019 when he accepted the position as the Dean of the College of Pharmacy and Health Sciences here at Texas Southern University. And in this role, he's serving as the Chief Academic Officer for the Doctor of Pharmacy program, as well as the 6th Health Sciences program in Health Administration. So thank you so much, Dr. Musavin, for joining us. Our next speaker that would come right after Dr. Musavin is also a very renowned physician, Dr. Terea Richmond. Dr. Richmond was born and raised in Chicago, Illinois. She graduated with a summa cum laude from Mount Saints College in Clinton, Iowa, and she received her Master's of Public Health and Doctorate of Medicine from the University of Illinois School of Public Health and College of Medicine. Dr. Richmond has experience in providing patient care to uninsured and underinsured patients at Acres Home Health Center, MLK Health Center, Bentov, and LBJ. She prides herself on providing excellent evidence-based medicine for communities of color. Nicknamed your total health doctor, Dr. Richmond serves as the Chief Medical Officer of the AIDS Foundation, Houston, as well as a primary care physician at your Total Health Clinic and Day Spa. So welcome, Dr. Richmond. We are very excited to have you. Without further ado, I will go ahead and turn it over to Dr. Musavin, and he will talk to us over a couple of minutes on the screening, COVID-19 screening, as well as COVID-19 vaccination efforts here on Texas Southern University campus. Over to you, Dr. Musavin. Thank you.
Thank you so much. I hope everybody can hear me. Dr. Oswale, thank you for your introduction. Dr. Richmond, thank you so much for being here with us this evening, and good evening to all of you participants. I won't take more than a few minutes, but I want to share with you a few thoughts and a few things that we have recently been engaged in since the arrival of the pandemic. And certainly being a College of Pharmacy Health Sciences where we are at TSU, we had a number of responsibilities when that happened in 3 different categories. First was instruction. We need to make sure that as students could no longer come to class, that we were prepared to be able to help them with their learning. But as I have always indicated throughout my career to my wonderful faculty and staff, the university also has a responsibility to the faculty, staff, students, and also to the community. So with that, the second area we wanted to focus on was testing. So through a collaborative effort with Thermo Fisher and a very, very large, generous grant from Bill and Melinda Gates Foundation, we were able to open a COVID-19 testing laboratory. It is actually fully functional where we can test. We administered a PCR test for COVID-19 testing, and that's available to our students, faculty, and staff. and allows us, hopefully, as we slowly go back to normal, that we can just test as many students and faculty as we need to. So that was a major effort that is completely underway, and we've done really well. The third area that relates more to this discussion this evening, and especially when you deal with chronic conditions such as hypertension, was vaccination. We felt like we need to be able to bring the vaccination to this campus and to this neighborhood. So we signed an agreement with Baylor St. Luke's Hospital, which is a very large health system, knowing that currently almost all of our classes are online. We were able to convert the lobby of our building, 3 classrooms, into a full vaccination clinic. We started on February 8th. I was the first person to be vaccinated, got my first dose on that day, and we continue. We're going to go all the way till July or August as needed. Yesterday, we vaccinated 700 people in the third ward community that came to our campus to be vaccinated. And as I'm sure Dr. Richmond will touch on, folks, the only way out of this pandemic is for us to get everybody vaccinated. Our vaccines are extremely scientifically researched extremely well, and they're extremely safe. And we need to make sure also as healthcare professionals that we pass on this message that even though some people might criticize us as to or the time period for testing was short, well, in fact, there are scientific reasons why that was the case. We have very safe and effective vaccines on the market in the US, and the goal should be to get everyone vaccinated. What you see on the screen is the link that you need if you're interested, and if you're qualified in the categories of 1A, 1B, and 1C, or if you're a teacher. The link is there for you to make an appointment. Again, we're open Monday through Friday, 7 a.m. to 7 p.m., and we typically plan for 700 vaccinations. I think we did about 700 today. We're about to finish up the day. Yesterday, as I think I mentioned, we did 733 vaccines. So we're here to serve the community, to serve students, faculty, those who qualify and fall into one of the categories for vaccination. So with that, again, please copy the link down. You can also, you're welcome, if the lines are shorter in a given day, you're welcome to come and stand in line. But really the best way is to go through the link, make an appointment, and come receive your vaccine. And with that, I will conclude my comments. Again, thank you for the invitation this evening to be with you, Dr. Oswale. And again, thank you, Dr. Richmond, to be with us. And I'll pass it on to Dr. Oswale at this point.
Thank you so much, Dr. Musavi, and thank you to all our audience. So the link that was shown on the slide is also posted in the chat box. So feel free to copy that link as well as the phone information. If it's easier for you to register by phone, please feel free to do that. Or if it's easier to register online, feel free to do that either way. Thank you again, Dr. Musavin. It's a pleasure to have you. At this point, I will go ahead and turn it over to Dr. Terea Richmond as she educates us about hypertension in the era of COVID-19. Over to you, Dr. Richmond. Thank you.
Good evening, and thank you all so much for having me. Over 700 people vaccinated. Congratulations. That is amazing work. It's amazing work in the community. As you all will see, I practice in the third ward community as well, and it's so important the work that TSU is doing. And I will say this, I received a series of texts and emails saying, hey, they're vaccinating at TSU, please share with your patients. And at that point, I'm not sure that I was vaccinated yet, but to make sure that we get the information out. So I certainly have been sharing about y'all's efforts, and prayerfully some of my patients have made it over and have been vaccinated, because I'm a 100% advocate, and you will see that in my presentation as well. Okay, and I need to share my screen. There we go, perfect. Okay. So again, hello everyone. I am Dr. Terea Richmond. I am again the founder of Your Total Health Clinic and Day Spa, and we are located again in Third Ward, the lower Third Ward area. But I live, breathe, and work in Third Ward, and so I'm excited to be here with you all this evening. I am a board certified family medicine physician, and our mission at the clinic is to provide quality evidence-based medicine with a compassionate and comprehensive approach to our patients' health and wellness. And it was established in January of 2020, and then of course COVID hit. So far, and this data probably has changed since yesterday, but we've had in the United States almost 30 million cases of COVID. I actually test for COVID in my clinic, where I do drive-up testing, and I've seen these positive cases. Most of my patients have had mild symptoms, but I do know of some people who have been hospitalized, and over 500,000 people in the United States have sadly succumb to COVID-19. Now, people, I think, still don't totally understand what is this virus and why do we keep saying this novel virus? What does that mean? Novel virus, excuse me. What does that mean? So the coronavirus has, been around for years, but this virus behaves in a new way that we had not seen before. And so in 2019, this virus introduced itself as a disease in China, and it just basically spread across the world over a very short period of time. But the actual name of the virus is SARS-CoV-2, and that's what we look at when we test and we check the antigen. We're actually looking at that particular virus. I like to think of the coronavirus as a group of cousins, that they are family members, and we've been, a lot of us have probably had exposure to, or have had a version of coronavirus as a cold, but this particular strain acts totally different than the previous coronaviruses we have been exposed to. You can, I believe, even look at the back of a Lysol bottle and it'll say coronavirus, and that's been on there for years. However, in 2019, this new virus just hit, and it was not expected what was happening and what was going to occur as far as getting to the level of a pandemic. So a lot of people don't know, and this is not as clear as I would like it to be, but I hope you can see this. A lot of people don't know what the definition of high blood pressure, hypertension, some people call it the pressure, but basically it is how the pressure that allows blood to circulate through your body. And we're able to check that with a cuff. Preferably, we like to check it with a manual one. So that means that the doctor will use a stethoscope and a cuff, and they will manually pump the cuff up. We also have the automatic blood pressure cuffs, and a lot of those are used in the home. We use them at the clinic, but if we see that the levels are elevated, it's always better to go back and recheck the blood pressure. Now, normal blood pressure is less than 120 over 180. So that's the top number and then the bottom number. And so the top number tells us how much pressure it takes for the heart to pump blood to the rest of the body. And then the bottom number lets us know how much pressure it takes for the heart to actually relax. So you're considered pre-hypertensive, meaning you're just at the cuff of being diagnosed with high blood pressure. And that's in the range of 120 to 139 at the top number, and then 80 over 89. And I would encourage you, and this is in adults 18 and over, I would encourage you to know your numbers. There's numbers including your number that screens and checks for diabetes, your cholesterol number, your weight or your BMI, which is your body mass index. And that's a calculation that we use in the clinic. A really rough measure of where your weight is and what you can check at home is to take a measuring tape and measure your waistline. For women, if it's over 35, you're at higher risk for developing things like high blood pressure and diabetes and high cholesterol. So that's a really rough measurement at home you can do, and it's 40 for men. So stage one hypertension is the top number is between 140 and 159, and the bottom number is 90 to 99. And then if your blood pressure is just, what people call out of control, that's when your blood pressure at the top number is greater than 160 and the bottom number can be greater than 100. And unfortunately, I've seen a lot of this, particularly over the last year, since we've been in a pandemic, since we've had so much racial tension. It's been so much going on that we're all experiencing some level of trauma or stress. And I've seen it time and time again at this point where it's affecting my patient's blood pressure to the point they're either were not on medication and did not have high blood pressure and now they do, or they have to have medication, have to start medication in addition to their lifestyle changes. People who have had to have doses increased of their medications, and then people who have been on classically have been on one medication have to go to two, or classically have been on two medications and have to go to three. So this year has been as far as blood pressure is concerned, has really, really increased, or this past year has really increased from what I can say anecdotally and what I see in the clinic, the levels of high blood pressure for a lot of people. So what is it that, what is it that we're concerned about when it comes to COVID-19 and high blood pressure? The lessons that we've learned, and what does the research show us? I know there's so much information and we keep learning more and more every day. What are the impacts of COVID-19? And then for anybody that has a pre-existing condition. So not only high blood pressure, asthma, COPD, where your lungs are affected, if you have cancer, or if you have HIV. So there's so many different comorbidities that we had to look at, or different diseases that we had to look at and see who's at the most risk for being hospitalized. So I'll talk about that a little bit more when it comes to high blood pressure in a moment. So this virus is so uncanny that and it's smart. So it's amazing to me that something that we can't see with the naked eye can be so smart and has found a way to basically integrate itself into cells and particular cells. And so I wanted to explain a little bit about that, because I think that our general population does not necessarily understand, like, why does this virus cause so much and wreak so much havoc on people's bodies? So basically the virus, once it enters the body, it ignites a hyper or overload of an inflammatory response, and specifically in the nose, the airways, and the lungs. This virus is so smart that it actually attaches to a specific, what we call receptor, so a specific spot on the cells where it gets into the cells. And because of the way it behaves once it's in the cells, it actually kills off healthy cells. And the main symptoms that we see are shortness of breath, and I'll talk about some more shortly. But shortness of breath is one of the symptoms that's representative of what's actually going on in the body. And what leads to the severe disease is mostly pneumonia. So, back years ago, we thought pneumonia, we would see more with patients that have diabetes, or patients that have who are living with HIV. And that pneumonia is so aggressive, and this particular pneumonia with COVID is so aggressive and so hard to treat that a lot of patients end up in the hospital having to be on ventilators, because the body is just having such a hard time fighting off the virus and trying to keep this hyperinflammatory response in check, that everything kind of goes awry. And then once one organ is affected, other organs like the heart, the kidneys, also can be affected by this kind of inflammatory response and attack on the person's own body. So I want to share a video to kind of give you a visualization of what the virus and what the virus is and how it works. So I'm gonna share with you a screen. So just give me one moment while I do that, and I'm gonna make sure I do it right. And this is actually a YouTube video. I see that it was put in the chat that you can take a look at it as well. Let's see here. Did I lose it? Just one moment. Give me 1 second. I need to pull that back up. So feel free to put your questions and thoughts in the chat. We definitely will come back to that at the end of the presentation and try to answer all of your questions as best as possible. I like to tell people that, you know, with this virus, we're still learning more and more information on a really a daily basis about how it behaves and what we can do to help to end this pandemic. All right, here we go. Okay.
In order to reproduce. Let's have a closer look. Inside the virus, genetic material contains the information to make more copies of itself. A protein shell provides a hard protective enclosure for the genetic material as the virus travels between the people it infects. An outer envelope allows the virus to infect cells by merging with the cell's outer membrane. Projecting from the envelope are spikes of protein molecules. Both a typical influenza virus and the new coronavirus use their spikes like a key to get inside a cell in your body, where it takes over the cell's internal machinery, repurposing it to build the components of new viruses. When an infected person talks, coughs, or sneezes, droplets carrying the virus may land in your mouth or nose and then move into your lungs. Once inside your body, the virus comes in contact with cells in your throat, nose, or lungs. One spike on the virus inserts into a receptor molecule on your healthy cell membrane like a key in a lock. This action allows the virus to get inside your cell. A typical flu virus would travel inside a sac made from your cell membrane to your cell's nucleus that houses all its genetic material. The coronavirus, on the other hand, doesn't need to enter the host cell nucleus. It can directly access parts of the host cell called ribosomes. Ribosomes use genetic information from the virus to make viral proteins, such as the spikes on the virus's surface. A packaging structure in your cell then carries the spikes in vesicles which merge with your cell's outer layer, the cell membrane. All the parts needed to create a new virus gather just beneath your cell's membrane. Then, a new virus begins to bud off from the cell's membrane. Now, with the virus spreading in your body, how can you develop pneumonia symptoms? For this, we'll have to look into your lungs. Each lung has separate sections called lobes. Normally, as you breathe, air moves freely through your trachea or windpipe, then through large tubes called bronchi, through smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Your airways and alveoli are flexible and springy. When you breathe in, each air sac inflates like a small balloon. And when you exhale, the sacs deflate. Small blood vessels called capillaries surround your alveoli. Oxygen from the air you breathe passes into your capillaries, and then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale. Your airways catch most germs in the mucus that lines your trachea, bronchi, and bronchioles. In a healthy body, hair-like cilia lining the tubes constantly push the mucus and germs out of your airways, where you might expel them by coughing. Normally, cells of your immune system attack viruses and germs that make it past your mucus and cilia and enter your alveoli. However, if your immune system is weakened, like in the case of a coronavirus infection, the virus can overwhelm your immune cells, and your bronchioles and alveoli become inflamed as your immune system attacks the multiplying viruses. The inflammation can cause your alveoli to fill with fluid, making it difficult for your body to get the oxygen it needs. You could develop lobar pneumonia, where one lobe of your lungs is affected, or you could have bronchopneumonia that affects many areas of both lungs. Pneumonia may cause difficulty breathing, chest pain, coughing, fever and chills, confusion, headache, muscle pain, and fatigue. It can also lead to more serious complications. Respiratory failure occurs when your breathing becomes so difficult that you need a machine called a ventilator to help you breathe. These are the machines that save lives and that medical device companies currently ramp up production for. Whether you would develop these symptoms depends on a lot of factors, such as your age and whether you already have an existing condition. While this
I'm gonna stop there and go back to my PowerPoint presentation. But I thought this video was a very good illustration of how the virus actually works in the body, and how it affects the lungs, how it affects the airways. When we talk about the symptoms and look at the symptoms of the coronavirus, it actually is very is a phenomenon to me that is in a way, and I know this because I'm a scientist. For example, the loss of smell and occurs because the virus is affecting those. We have those nice little fingers that you see in the nose, and then we also have a lot of nerves in the nose. I don't know about you all, but I've had probably at this point 7, maybe 8 COVID tests, the PCR test, that checks the antigen, that we do the swabs in your nose. And I always like to explain to patients that when we do that swab, that you may feel tingling, you may feel just like your nose is on fire, and you may have sneezing and tearing, but it's just amazing that the body is all connected in that way, and the airways are all connected in that way. And when we do that test to check for the virus, it's affecting that region of your airways, and that's why you lose, for example, that's why you lose smell. So if my patients call and say they can't smell, especially in the last year, they don't get to come into clinic. They will have to be tested from their car. But some of the COVID-19 symptoms, some symptoms we realized later on, but the main ones are fever, cough, shortness of breath or trouble breathing. I know some patients have complained of chest pain, and not so much like it feels like they're having a heart attack, but just that it's difficult to breathe in and out, and it actually hurts the outer part of the chest. Chills, shaking, particularly at nighttime, body aches, headache, sore throat, congestion and runny nose, loss of taste, loss of smell. And then later on, we found that some patients have nausea, vomiting, and diarrhea. And the symptoms sound very much like the flu at this point. So the only way to determine if it's the flu or if it's coronavirus or COVID is to really get tested. All right, so as far as high blood pressure and COVID-19, people who have uncontrolled or untreated high blood pressure, and I see this a lot, particularly in the communities of color, may be at risk of getting severely ill with COVID-19. It is so important to know that untreated high blood pressure seems to put people at more risk of the complications from COVID-19, particularly if they're not on medication. If you have high blood pressure, the most important step that you can take to help to prevent severe illness, well, one of them, I'm not gonna say that's the most important one. One of them is to make sure that it's managed, to make sure that you follow up and develop a treatment plan with your doctor. Now, I also know people are saying, well, how can I see the doctor if we have all these rules about being in the clinic? Well, the great thing is that over the last year, telemedicine has really taken off. And so I tease all the time, most people have some type of phone. You could even do your visit from your cell phone. And what I will recommend is if you're being seen for blood pressure, that you make sure that you have a blood pressure cuff. And like I said, we like to do the manual ones, but for the purposes of being at home and seeing a doctor from home, it's good to even have the automatic one where you can have it, you can check it at home in real time while you're seeing the doctor. Keeping a log of your blood pressure is also very helpful for the doctor to help manage and determine which, if any, medications you need to be on. Now, for managed high blood pressure, based off of the CDC, high blood pressure is possibly put you at a possible increased risk for severe illness with coronavirus. So you may get the kind of mild symptoms of coronavirus if you have high blood pressure, particularly if you have uncontrollable high blood pressure. Then a likelihood that you can be hospitalized for coronavirus or for COVID is relatively high. And then putting that together with other comorbidities, and I see this all the time. The triple, the kind of triple one that I see is high blood pressure, diabetes, high cholesterol, and we might as well throw in overweight or obesity. Now, how can you change your lifestyle to help improve your blood pressure? And the answer is absolutely yes. So eating a well-balanced diet. Now, I know that sometimes we may not have as many choices on what, as far as what foods we eat, but one thing we can do is not add salt. So we can leave that off the table. And I like to qualify this by saying, what is salt? So most people think of salt as the iodine salt that you get off the shelf, but most of us don't really even use that. We use other things like, now that I'm from Chicago, so honestly, I had not heard of Tony's until I moved to Houston. And it tickles me so, because my patients be like, oh no, I don't use salt, I use Tony's. I said, okay, I gotta go to the store and look at this Tony's. And Tony's is salt. Tony's is salt, seasoning salt, Saison, Adobe, they all have salt in them. And actually, if you look at the ingredients on most of them, salt is the first ingredient. That's why it tastes so good. So making sure that whatever seasonings you use on your food, to make sure that they're like low salt or preferably no salt. And then also limiting alcohol intake, trying to enjoy regular physical activity. American Heart Association recommends at least 150 minutes of cardiovascular exercise. And that doesn't mean you got to go and, do a marathon, but you can get out, with your mask and take a walk on a daily basis. Also managing stress. For my patients that have high blood pressure, a lot of my patients have high stress lives. One of the things that I would recommend, if they can at all possible, do behavioral therapy to help manage their stress. And even if it's via, again, their telephone, there are options to talk to therapists via the telephone. And then also just maintaining a healthy weight. And then finally, not smoking cigarettes. I forget the name of those things. Cigarettes, the little, they make it like it's not tobacco, but it is tobacco. I can't think of the name of those right now, but any of that hookah, trying to stay away from smoking as well. So there's a wide variety of blood pressure medications. I'm not going to go into a whole pharmacologic talk, but I did want to talk about the most common medications that people are on. So for example, diuretics, We call it HCTZ, but that's hydrochlorothiazide. That medication is considered one of the first lines. And it actually, when we say diuretics, that means that it makes you go use the restroom. And so that takes some of the load of the fluid in your body that your heart has to work against to improve your blood pressure. And then beta blockers, you maybe have seen these, and this is not an all inclusive list, but metoprolol and atenolol help to bring down the blood pressure. They also help to slow the heart down so that it has time to feel and it has time to relax. And that also helps with if you have an increased heart rate. ACE inhibitors, again, it's another one that's on the that is on the first line of treatment list, particularly for anyone that has diabetes. It's protective of your kidneys, and you may even be on a small dose of it just to protect your kidneys if you have the comorbidities. But it really does help with the blood pressure, particularly in people of color. The second one, or excuse me, the next one, the angiotensin 2 receptor blockers. Those work at kind of the same way as the ACE inhibitors, but when we usually start those, we either start on first line or we may start them after you've taken an ACE inhibitor like lisinopril, which can cause a significant cough. So just keep that in mind. If you're having a consistent cough and you're taking a lisinopril, enalapril, midazopril, you may want to talk to your doctor about the medication because it can cause a dry cough. And finally, the calcium channel blockers, amlodipine, nifedipine. There's a few more diltiazem that are also considered at this point first line of treatment, particularly for people of color as well, to really get the blood pressure under control. Some of the other ones, the alpha blockers, is clonidine. So clonidine is almost at the last line of what we will start for blood pressure, because if you miss a dose, you can have a rebound high blood pressure, meaning if you miss a dose, your blood pressure has been controlled on it, but if you miss it, the blood pressure can go up really high. But sometimes we have to add that on. So I also wanted to say this for blood pressure management. You know, you may be on a medication and you feel like it's not working, but it's actually able to keep your blood pressure where it is. And the management of the blood pressure a lot of times is additive, meaning if you start out on a low dose, we may have to increase the dose of the same medication. And once that's maxed out, we may need to add on another medication. Most of my patients that have high blood pressure who are not as engaged in some of the lifestyle changes are on 2 medications to manage their blood pressure. All right, so if I have hypertension, high blood pressure, should I get vaccinated? And the answer is absolutely yes. Protect yourself against the serious health issues that high blood pressure can cause is especially important with COVID-19, and get the vaccine. So I am very big on telling my patients to do things or recommending patients to engage in medical care or vaccinations or exercise, because I do it myself. So I actually got the Pfizer vaccination. I already finished all my 2 doses. The first time I got the vaccination, my arm was a little bit sore. The next day I was a little bit tired, fatigued. However, I'm pretty busy as a wife, a mother, a doctor, business owner. So that could have been it as well. So I can't totally say that it was the vaccination. The second time I got my second shot, which is about 3 weeks, it was about 3 weeks from the first one. I felt a little bit fatigued, but not so much with the sore arm. And I haven't had any, there's memes everywhere, social media, where people growing another ear, and it's so important to say this, the vaccination, that is not DNA material being injected into people. It is a manufactured vaccination based off of the way we saw that video, based off of the way the coronavirus is formed. So again, I got the Pfizer vaccination. The Moderna is the other option. And again, it's a 2-dose vaccination. It's really, really important that if we're gonna get to herd immunity, it's not gonna be a Corona party or a COVID party that's gonna do it, or hanging out, you know, in the community and you haven't been vaccinated. It's gonna be getting us to our basically 90% of the community being vaccinated. So the other, I just wanted to touch on this a little bit because I know that there's a lot of different information about the strains of the virus. And again, the virus is very smart and it can mutate, it can change itself and to develop into different variants. And we've seen that in the United Kingdom, South Africa, and Brazil, and now we've seen it in the States. And so it's going to be really, really important. I can't reiterate this enough, that you get vaccinated. I would still say and recommend that you wear a mask. I know previously we didn't wear masks to protect ourselves from the flu, but I haven't seen very many cases of the flu at all. And it's going into, we're coming out of flu season and going into another one. So it may, besides being protective against the coronavirus, at this point may be helping to prevent some of the spread of some of the other respiratory viruses that we see as well. All right, this is my references slide. Thank you all so much. I hope that I was able to give some information today that helps someone. Again, click on the link or call and make your appointment or request your appointment to get your vaccination. It's really, really important. So thank you all so much.
Dr. Richmond and Dr. Mosavin, thank you both so much for such informative presentations and information. I'm gonna go ahead and get this up. So we've reached the point now of our Q&A session. And so if there's anyone with a question, we do ask that you go ahead and place that information into the Q&A or into the chat feature. We did have a couple of comments. So one that I would think we should probably talk about it. So someone, when you were talking about salt, Dr. Richmond, someone said not eating salt is very hard. And so just curious to know, are there any salt alternatives or ways we can realistically limit salt intake? Because the thought of just food with no salt is hard for me to imagine too.
So one of my suggestions is that consider trying sea salt, but and it's very to me, it's very salty.
Mm-hmm.
So I would recommend just using a little bit of it. I understand we have to retrain our taste buds. So if you're not going to, if you're like, okay, well, I just can't do any salt, you can use a little bit and try to enhance the flavors with garlic and onion and bell pepper and celery, other seasonings to help enhance your food. But I understand, I get it. But even if it's just a little bit of a sprinkle, or I don't know if you've seen this, Dr. Lau, but if you go out to dinner or maybe you sit down with your family, the food is already seasoned, and even before tasting it, people are picking up their salt and pouring it all on the food. I would recommend maybe not doing that either. Maybe taste the food first before you go in with the salt.
Okay, all right. Well, thank you for that. I will have to work with it.
Okay.
So the next question, someone on our Facebook stream asked, which high blood pressure medication, how am I supposed to know which high blood pressure medication is best for me?
You definitely need to, if you have not at this point, you definitely need to establish a primary care physician. And there, I know that there's a lot of things going on with insurance now. If you don't have insurance, there are, if you live in Harris County, there is the opportunity to apply for the Gold Card or to look at the marketplace for insurance, Or again, telemedicine is an option as well. So you may not know exactly what medication will work best for you. And so that's the reason why I'm recommending develop a relationship with the primary care physician, because we are trained and do understand that not all medications work the same and well for everyone. And there's certain indications where certain medications you absolutely should not take if you have certain medical problems already, if you have certain allergies. So it really will require an assessment by a physician to help to make that decision, collaboratively to make that decision. So I'll give you an example with the hydrochlorothiazide. It is a water pill. So it is going to make you go to the restroom pretty regularly. Some people can't do that. They may have to work, or they may have to, sit, or they may already have problems holding their urine. So that would be a good choice, a good lifestyle choice, so that there's going to need to be some discussion with the doctor to decide what's best for you.
Okay. So they need to take it on a case by case kind of
Absolutely.
in consultation with the doctor. Okay. Another question that I had, and I'm sure I'm having a hard time seeing the chat feature, but a question that I have is, one of the things I've heard people say when it comes to the vaccine is that they were hesitant. And the reason that they were hesitant maybe is because they take medications or they do have underlying health issues. And maybe they were kind of worried about interactions or unintended consequences as a result of taking the vaccine. Could you speak to that?
So are we speaking of long-term consequences or?
Just the unknown, I think.
No, absolutely. So I will tell you that I had to contemplate, do my own research. And Dr. Lau, we've been in enough sessions together at this point that that I will speak to, the mistrust of the medical community. So I understand why there's hesitation. We are all sort of in an experiment. But once I did my research, and I understand that, long-term, we'll have to see. We still don't have the answers to that, but short-term and based off of the studies that have already been done, it is effective and it's better and more advantageous, particularly if you have comorbidities, to go ahead and get it. If you're in those classification, if you're at either one of those classifications, 1A, 1B, or 1C, to go ahead and get the vaccination. And then I also wanted to say, the virus has been studied. If you look at the Moderna, Dr. Kizzy, she is a Black female, was one of the main scientists who was studying this virus, but they were already studying this virus to develop a vaccination. They were already looking at it because if y'all remember, we had a SARS outbreak. I can't remember how many years ago it's been now, but we had a SARS outbreak. And so that virus has been studied and has been worked on to develop. They had already been working on it to develop a vaccination, and then they had to swiftly pivot to make it more specific to SARS-2. But that's what I would say, that definitely do your research. We don't know all the answers, but what we do know is that over 500,000 people plus have died of the coronavirus, that's only in the United States.
Okay, thank you for that. So it sounds as if we don't know all the answers like you just said, but we stand a better chance of protecting ourselves if we go ahead and just take the vaccine.
Absolutely, thank you.
Thank you for answering that. Okay, I'm gonna stop sharing because I can't really see the chat for just a second. Are there any other questions from any attendees?
Miss Rosetta Thompson has a hands up. There are no other questions in the chat box, but I will go ahead and bring Miss Rosetta up so she can talk about that question. Just 1 second. Okay, Ms. Rosetta, please feel free to unmute yourself so you can ask your question.
About whether those with high blood pressure can take the vaccine. And if they can take the vaccine, which of the vaccine is more appropriate for them to take? Because I know that we have various types. Some have been reacting. We have been hearing complaints about some that are reacting badly, and some that are, well, still okay. But I want to know, is it compulsory that when you have high blood pressure, you still have to take the vaccine?
All right, I'll take that. Miss Rosetta, I definitely want to, I can bring my slide back up, but that's one of the main slides that I have that says if you have high blood pressure, should you take the vaccine? And the answer is yes. Both the Pfizer and the Moderna are available. Either one of them is fine. So if you have the opportunity to take it and you have high blood pressure, any of the other comorbidities, or you're in that 1A, 1B, 1C class, definitely, if you came to see me in clinic, I would give you the same recommendation. Ms. Rosetta, does that help?
Yes, it's helpful. Thank you.
You're welcome. I thought I saw another hand up.
I think it was just Ms. Rosetta. The other person said the hand was up in error. They didn't have any questions to ask.
Okay, okay, yeah. Awesome.
Thank you. Dr. Loud, you are still on mute.
Okay, thank you. All right, so Dr. Richmond and Dr. Musavin, thank you again. I believe we have your contact information, so we can certainly share it with attendees if maybe they have some questions later or want to follow up with you. So we'll go ahead and move forward with just reminding all attendees about the survey. We have one in English, one in Spanish, and the first 10 to complete the survey will be eligible for a $10 gift card. So it really helps us out if you kind of give us the feedback so we can know how to design future seminars that meet your needs. Some upcoming events, we have our April seminar, which will focus on self-care and resources for people living with hypertension and their caregivers. And we're also asking everyone to save the date for our first annual research conference, where we'll be working together to talk about clinical research engagement and just kind of understanding some of the things you need to know in order to have a voice and be a part of the clinical research environment. Lastly, we ask that you please follow us. We're on Twitter, Instagram, Facebook. Our handle is CEC Texas Southern, TX Southern U, or you can text us at 832-264-9031. We'd love to have you to continue following us and engaging with us so that we can create content specifically for you. And so this concludes our March seminar. We thank everyone for your attendance. Have a great evening.